I'm a strong advocate for fluoridation in the water and making sure you use that in your toothpaste. And that's somewhat of a controversy in some parts of the country or the world because fluoride can be considered a poison, but anything is if you get it too high a dose. I've seen people in the military in particular, young men and healthy females come in the military, perfectly healthy, never had a cavity in their lives. Plenty of people like that out there in the world. Go out, live their lives. Now they come home with a case of Mountain Dew and a pack of Doritos, and almost half their teeth are rotted out. First of all, in 25 years I've been practicing as a dentist, I've never seen it go away. And it only gets reduced. And it only gets reduced maybe to a manageable phase. It rarely makes much of a difference. That's why I felt terrible about seeing them, because it just didn't make a difference. She came back to see me. She had the soft tissue architecture of a healthy 20-year-old. I was flabbergasted.
This morning, we have a special guest. Derrick is here from, and I'm not sure exactly where, Derrick, what part of the world are you in?
I'm in
Northern California. Okay.
It's about an hour and a half to 2 hours north of Sacramento. Small town of about 100,000 people.
Okay.
And I work in another little town about an hour north of here in Redding. That's about 100,000 people too.
Yeah.
So little smaller towns.
Okay. I've been through Redding.
Oh, good.
So I'm looking at your scrubs there. So obviously you do, it looks like you do dentistry. So I'm guessing if that's correct, if I'm wrong.
Yeah, that's right. That's why I'm talking to you. So I'm really glad that, and surprised actually. I wrote you a letter just because I thought it'd be interesting to get some of the information out that has come across my way, because I've been following this lifestyle or eating a carnivore diet for a while and was not really giving it to my patients as any kind of direction. I wasn't trying to encourage them to do that, but it stumbled onto it. But anyway, so I wrote you a letter, and I guess your staff decided to reach out to me this way. I'm happy to talk. I'd love to do it.
Yeah. So what, let me just, I guess, by way of a little more background, how long have you been practicing dentistry? What got you into that? And do you have a specific type? I know there's different specialties within dentistry.
Yeah, I'm a periodontist. It's a subspecialty in dentistry, and we focus on surgical procedures to correct all kinds of defects that happen in the mouth, mainly disease-based. But we do some trauma cases. Oral surgeons will do more of the trauma cases. They do one side of the surgery side of the spectrum. We do the other side when it's more disease-based. And I've been practicing for 25 years. I was in the military. They pay for school, and you go work in the military for many years. Only had to do 4, but we stayed there for 15 years. When I ended that stint, came to Chico. Been here for 10 years. Practicing as a periodontist here. Solo practice. I've had a couple of colleagues I've collaborated with, especially the one from whom I purchased the practice, but pretty much practice alone.
Yeah, I know the military and the medicine thing did something similar myself. They paid for my surgical training and so on and so forth. So I, returned the.
What branch are you in?
I was in the Air Force. I did about 11 years in the Air Force. 5 is initially outside of medicine as a nuclear weapons guy, and then I got sent to medical school and did all that and came back in as a trauma surgeon, or as an orthopedic surgeon, did trauma, deployed. Let me ask you, so you said you primarily treat diseases of the mouth. And so what are those diseases that you would commonly see?
The things that destroy a lot of the substructures, periodontal disease. It's going to be an inflammatory disease process. It's associated with a bacterial infection always. That's the primary cause. But you've got a lot of secondary factors that can increase your tendency towards that. There's genetics. That's a component of it. As a matter of fact, I saw a patient, and you'll see a subset of 1 to 3 of the patient population where it doesn't matter what they do, they're going to be fantastic. And I saw someone a few years back, he's 55, he'd never seen a dentist in his life. He came to see me, and a tooth had finally popped out. He needed to have me place a titanium implant in, and I thought, my word, we're never going to get to that. And then as I did my exam and got to know him a little better, he told me he only brushed once a week. There was nothing wrong with the guy. And I thought we were going to have to spend decades of work catching up on things. So it's interesting that some people genetically are just not affected in any way. And you got other people on the other end that are heroic in all their efforts, and then they crash and burn, regardless of how well they follow all of our instructions and do things on their own part. In the middle, it's a disease-based aspect that focuses primarily on this bacterial infection. Doesn't really affect people until after the age of 35. It's rare that I'll see anyone under that age. So there's an immune component in the sense that as you get older, whether it's genetics or whether it's age, you're going to be more compromised. So most of my patients are over the age of 50 and have this either inability to fight it off, either because we can tweak maybe their oral hygiene a little bit, or we can modify other things. That wasn't the thing that made me want to discuss things with you. Part of it was I followed Jordan Peterson, and one of the things that he made a statement about was that his periodontal disease has vanished. And I can see that may be true when somebody has already started some of the initial treatment. But if someone's never had any treatment and all of a sudden they think that one of the things that they can do is just change their carnivore diet, I wanted to make sure people knew there are some scenarios where it's not going to be the magic pill. And I know for me, I've had a remarkable experience with how it's changed my life, and in surprising ways. But certainly, whenever you say the word always and whenever you say the word never, you're going to fall into a lot of trouble. It cannot solve all problems. And when he said that, I could see, wow, once you've had the initial treatment, I can see that you can get to a point where you can shift the inflammatory profile in some way to get you to a point where, yeah, now you no longer need some of the other things that we might need to throw at you. It can shift you back more towards this other guy that I described. A protein diet, I think, can definitely play a role that way. Anyway, it gives you a little bit of a brief as to how I look at things.
Our teeth theoretically are supposed to last us our lifetime, right? And this is, you look through the fossil records of prehistoric humans, sometimes the only thing you find are teeth. Everything else is decay. Our teeth are the hardest substance in our body, presumably. And yet, what percentage of, maybe you don't know these numbers, maybe they're not out there, but what percentage of American adults have missing teeth, problematic teeth? Is it 50%? Is it higher? By the time you're 67 years of age, what's the dental health of the average American?
I'd say most westernized nations in the world, you're going to find that most people have at least some or all of their teeth. And I think part of that has been the fluoride push. So I'm a strong advocate for fluoridation in the water and making sure you use that in your toothpaste. And that's somewhat of a controversy in some parts of the country or the world, because fluoride can be considered a poison. But anything is if you get it too high a dose. That's the definition of a poison. But most people do have their teeth. Most have their teeth these days. I would say it would be anywhere from 10 to 20%, depending on what part of the country you're in. Economic standards and your background and access to care certainly is going to play a role. But it is interesting that when you lose your teeth, for what we deal with, the teeth are perfectly healthy. You have a tooth periodontally, it's the substructures. The bone starts to erode. The soft tissue interface between the bone and the teeth erodes, and the teeth just get loose. You'll bite down and they pop out. Periodontal disease doesn't affect the teeth. It affects the surrounding structures that hold the teeth in place. When that gets eroded, we can either eradicate the inflammation that's causing it, but also we spend a lot of time grafting the architecture back. Bone, soft tissue. That's where the majority of my time is going to be spending, and that's where I'll be right after we're done with this. I got a big case regarding that, but that's just the day in and day out of what I do.
The fluoridation, which you say you're an advocate of, when was that introduced? Or was it like the 1930s? Or I don't remember when fluoride was.
Yeah, early 1900s. Yeah, it was introduced. There was a dentist in Colorado who noticed that his patients tended to not need any work from him, but their teeth looked terrible because they had high concentrations of fluoride in the water. So showing, and that it was a proof of principle for us that you can have too much fluoride, but the fluoride was so prevalent that their teeth could not get decayed very easily. As a dentist, he didn't have a lot of work as far as fillings were concerned. But anyway, that led in the early 1900s to trying to figure out what in the world it was that led to the fluoride. And you can get too much, like I was just saying, and you get the right amount, and it's led to, when I was in the military, one of the things I went on a couple of deployments. They were brief. They're more humanitarian aid missions. But you go into a third world country and you see a beautiful young woman, handsome young man. They smile, half their teeth are gone. You don't see that in the United States, but you had a lot of other parts of the world. And part of that is the fluoride aspect. Another is carbohydrates. And you start introducing that, you have caries is a big problem.
Yeah, and I think that's something, because if like you think of why in the early 1900s were people losing their teeth, but you go back to, I'm obviously just a silly example. You remember, like, I hear about George Washington having a set of like wooden teeth made for him back in obviously the late 1700s. So something in the diet was rotting people's teeth, and some people will point to agriculture, the adoption of a basically a grain-based agrarian society, and then we saw dental problems ever since that time. Had we perhaps not done that, maybe we wouldn't have needed. Maybe the fluoride would have not. Maybe it would have been rendered unnecessary. Perhaps.
I do believe that. I think that's true. You get this high, especially with the higher glycemic index of things. Like one of the things my wife and I, when we were on vacation in England, we talked about, or they on a tour, they talked about how royalty would rub honey into their teeth. That's extremely high glycemic index. That's just sugar. And you're instantly going to cause things to just rot away that way. I think that if we were on a much higher form of, because that's true as far as hunter-gatherers, didn't have any problems as far as cavities or caries. So it goes along with that whole idea. You're right. The diet is definitely something that can play a role in that, and may mean that you don't need it. Because another way to be able to, because the way the fluoride works is fluoride doesn't just prevent decay. It's also a reversive medication of sorts, meaning that when you eat throughout the day, you're going to have carbohydrates no matter what. You're going to feed the bacteria in your mouth. They release it. Acid makes holes. They're microscopic. So you don't get a large cavity, you get minor amounts of it. And as you accumulate it day by day, eventually they'll coalesce. You get a large area, and then it can't be remineralized. But fluoride can do that. Fluoride can go in, or calcium in your saliva, goes in and re-solidify. So you make the holes by eating a regular meal or regular pattern of meals throughout the day. And then if you brush long enough with the fluoridated toothpaste, or if you have enough calcium, or if you haven't made very many, you go back to zero. You just want to go back to zero. And so fluoride is more of a reparative type of medication rather than preventive, though it does prevent by increasing the crystal structure or strengthening it so it takes longer for acid to make holes. But that's decay, and I don't deal with that too much anymore in my life. But
nonetheless, it's an interesting topic. And you think about, you said acid production through the metabolism of carbohydrates in the mouth. You mentioned honey. I know I've seen something like in reference to the Hadza, the sort of hunter-gatherer tribe from Kenya, Tanzania, and they said that the males were more likely to develop decay than the females because the males are out there gnawing on honey. They're the ones out there doing it. They tend to overconsume honey compared to the females. There's a lot of people that are thinking honey is this magical elixir has enzymes and different nutritive properties, and yet you'd say that still leads to dental decay if you consume it in a significant quantity, correct?
Oh yeah. If it can feed the bacteria and they can then release the acid by metabolizing it, it's going to cause problems. There's all kinds of ways to introduce acid. People will suck on lemons, same problem. Or probably one of the biggest problems we have now are people are sitting in front of a computer and you tend to sip something sweet. Yeah. It can be your Mountain Dew. It can be sugar in your coffee. It can be Gatorade. You take it every time you hit your lips, so to speak, you get a 5-minute burst of acid. The acid that's released by the bacteria lasts for about 20 minutes, but it really peaks at 3 to 5 minutes. And so every time you put something in your mouth, you're getting a 5-minute burst of acid, so to speak. That's okay if you have 3 meals a day. But if you snack or take a drink all day long, take a drink, put it down, take a drink, put it down, and you got thousands of those microbursts of acid. And I've seen people in the military in particular, young men and healthy females come in the military, perfectly healthy, never had a cavity in their lives. Plenty of people like that out there in the world. Go out, live their lives. And now they come home with a case of Mountain Dew and a pack of Doritos, and half their teeth are rotted out. You can have that kind of massive amount of change in a year. And it was terrible to see, all because of the carbohydrate status or introducing these snacking events, I think.
Yeah. And I'm wondering if, I know a lot of these carbonated soft drinks, in addition to obviously the sugar content, but even the sugar-free, they have phosphoric acid in there. Is that also potentially problematic? These diet
drinks? It
doesn't play
as big a role, but it does. Yeah. Especially some of these the energy drinks, like you're just saying, they really try to intensify the flavor in a lot of different ways. Yeah, you get the pH low enough with whatever mechanism, and you're sipping on that all day. Yeah.
Yeah, interesting. And now you mentioned, because obviously we talk about dental decay or caries, and then you're more interested in the periodontal aspects, but don't in many cases the same things that lead to the caries, the cavities, also subsequently cause the periodontal issues, or am I not thinking right on that?
Not really. You would think they would. And it's a totally different set of bacteria. The bacteria that cause cavities are strep mutans and lactobacilli, and it's limited to them. Those are the bacteria, and it's endemic for everyone. You can't get rid of them. We're trying to come up with, or at least they were trying to find a way to be able to make it so that they don't exist. They're going to exist. And so what you have to do is find a way to manage them. Those are the bacteria associated with caries. The bacteria that are associated with periodontal disease is a different type of pathogen. And they tend to be gram positive or gram negative. They tend to be anaerobic, so they're going to be in deeper substructures. Mutan is going to be aerobic, and it's going to be more easily removed. The periodontal pathogens are more challenging because they get into places that even flossing and brushing can be difficult, and that's why cleaning is sometimes probably the more important thing for somebody than how well they brush. But different set of bacteria, they can be commensurate, because if you do get a cavity that creates the nidus for a place for these other kinds of bacteria that all of a sudden they have the environment to start to propagate undisturbed, then they can connect, but one doesn't cause the other. We just help to create the environment for it if they go deep enough with the cavity.
Yeah, so different.
But most people with cavities never have problems. Again, not until they're old enough. They've got to be old enough. If somebody is under the age of 35 and I see them, well, they've got AIDS, they're immunocompromised in some way, it's the boy in the plastic bubble type of scenario. So very rare. And they're the ones that have cavities. After the age of 35, very rare for people to need a lot of fillings after the age of 35. It's still there, but much more common in a younger population.
Yeah, it's interesting. And I kind of wonder why kids are more prone to cavities and adults are more prone to periodontal disease. What's going on with the kids? Is there some immaturity of the teeth, or is it lack of fluoride accumulation, perhaps? I don't know.
The body is interesting because I'm dealing with bone all the time. And with your background, I'm sure you're familiar with this. We get a whole new skeleton every 10 years. And I get to work with that. I can manipulate that and help the body give me something. But with teeth, like you were saying earlier, what you get never changes. You never replenish that. And my theory with kids is that it's just very challenging for a child to be concerted in doing something that's boring and to develop a hygiene routine that's going to benefit them no matter, even for me and my kids, they've done well, but they didn't like hearing these things that I'm talking to you about. And that's what I talk about at the dinner table, but they would zone out, and like most kids. And I think that's the trouble, is that you start to develop the problem or the habits once the problems develop. It takes years to develop cavities. And then once you do, you start to get on board with that. And I think that's what happens with kids, is the pain and the suffering of having to see a dentist doesn't really start happening until they're old enough to all of a sudden get the message. And then usually in their 20s, most people. And so I think it's more habits. Certainly you didn't used to see this, like you said, 100 years ago, even in kids, but you do now. And I think the epidemic that I'm seeing with kids, which is terrible, it's just this snacking phase that they go through, carbohydrates, just like you said. I think it's unfortunate for kids right now, because I've seen so many that are perfect, and others now I think are going to get swept into this whole new, we're going to have a lot of business from what's going on with the way the food industry is marketing a lot of these snackable foods.
Yeah, people argue about what's the best diet, and I would say a diet that rots your teeth is probably not appropriate for us to be eating. Is that fair to say?
Oh, yeah. No. Yeah, how do we change that? Boy, that's a tough thing, because, that you have marketing going on, and you're absolutely right. I fear for that, because I think a lot of people think they mostly have pretty good instincts, but then you go by the supermarket and you're enticed. And then when you taste it, it tends to make you want to eat more of it, and you get sucked into, and you lose the ability to even think. You just want to. I've had those bags of Doritos, man, I can't stop. I go right down to the bottom, or at least I used to.
Let me just delve into because you'd mentioned Jordan Peterson, who a lot of people were exposed to carnivore through him because of he's got obviously a large audience. But what happened with you specifically? And then we can talk more about the dental stuff.
Yeah, for me, I was not interested really in changing. I didn't think I needed to. I thought I was pretty healthy. I ran into a problem at work. My business partner got leukemia, and he called me up and he told me about it. I didn't want to lose his practice. He's the guy. That's how I'm connected to Redding. And I said, look, I'll take over your practice. I'll come up there 2 days a week. I stay down here 4 days a week. I was working 6 days a week. I was working 14-hour days. And I ended up doing that for 4 years, and still doing it now. But in the middle of all that, I was really fatigued. It was great because as I go up to Redding back and forth, these hour-long drives, I was listening to Jordan Peterson a lot. I heard the story about his daughter when she was interviewed by Joe Rogan, and was flabbergasted that she had to go to this stage of her life to find a solution, and amazed that she found it on her own, realized that there were a lot of things that helped her and guide her, that she talked to you. But I didn't think that was for me. But I did realize, man, I just felt exhausted. I didn't know how long I'd be able to keep doing things. And I talked to some family members, and we were going over my grandfather's life, and he died of dementia. And he was a skinny guy. But one of the things that my family grew up in South America. When we moved back to the United States, I was about 8 years old, and I love my grandparents. And we spent a lot of time with them because we'd never been around them. He was a guy that was always drinking Coca-Cola, and we got introduced to all kinds of carbohydrates when we came back to the United States. But I realized as I was thinking back, dementia, I know that Alzheimer's is connected now to the insulin spikes or the problems with diabetes. Now it's type 3 diabetes, at least for some people in their minds. So I thought, you know what? I don't want that in my life. I'm a skinny guy. I'd run triathlons, felt like I was in pretty good shape. My weight was getting a little affected because of not being able to work out going up to Redding. I was maybe at 155 I'm 5'8". And I thought, you know what? Maybe I could lose a few pounds, but I want the energy and if it can help. So I just experimented. I saw that Joe Rogan clip where he said, I'm going to try it for a month. And I said, all right, I can do that if it gives me the energy. And it did. It did. There were a lot of things. Another thing. So first of all, the thing that was really flabbergasting is I dropped 25 pounds. I went to 135. I thought my baseline solid weight when I was doing triathlons was 150. I thought I needed to lose maybe 2 or 3 pounds now that I was a little bit older. And I wasn't working out. I was just working at work, just driving to work. So without exercising, I dropped down to 135. Was not something that I wanted. And I did get my energy back. And so I said, I'm locked on. It's been a year and a half now, and I haven't changed because I've gotten those two big things back without really having to do anything. And I realized I can't change this. It's too good for me right now. I certainly need it. The other thing that happened is I have these dark moods that happen in my week a couple times, almost every week. All that's gone. And when Michaela Peterson talked about her depression also being lifted, I was amazed by that. I didn't realize that was really a part because I'd never been diagnosed with depression. But when I realized that was just moderated for me, it was remarkable, like I said. And it's certainly something that has made me really an advocate. At the same time, I'm hesitant about it in other ways that we can talk about later if you want, but definitely. And now I can tell you about how it worked with a patient. I had a patient that came in to see me. I tend to not want to see the patients that have mucositis issues. A mucositis issue is something that's on the periphery. It's not associated with teeth, not periodontal disease. It's an inflammatory component. It's almost always autoimmune. It's idiopathic, which just means we don't know what's causing it. And I have told my staff, do not funnel these patients to me because I can't do anything for them. I feel terrible because all I can do is put them on an autoimmune suppressant, try to identify the cause, the etiology in some way, but often you can't because it's autoimmune or they got into my schedule. I was annoyed by it. I was trying to get the patient out of my chair. I tried to give her my honest time, but really was to already explain what I've just explained. I can't do anything for you. If you really want to try something, you can try this. It's going to cause other problems. I said, but I remember Bella, the steak and butter gal. I saw her on the internet, and I remember that I was flabbergasted by seeing her skin change. She had the pitted acne, and I'd never seen that resolve in anybody. And when she showed that after she'd been on the carnivore diet, that her skin condition resolved, it looked beautiful. Made me think for this patient, I said, you know what? You've got a skin condition. It's intraoral. It's a terrible inflammatory problem. And this lady was crying because of the pain. And I said, I want to do something you can try. And I went through the spiel of what you could do. I sent her a bunch of podcasts and your podcast, other podcasts, so you can get the rationale down, other people's take on it, especially physicians. I want someone who has a frame of mind where they can explain it rationally rather than just trying to say, you should do this because I do it. Anyway, as she was leaving, she said, I'm going to try it, especially because I focus on the insulin. She said, you know what? I want to let you know something about my diabetes, because she did have diabetes. My physician had recently switched or added more to my diabetic protocol, the way management. They had to switch me to insulin, taking metformin. And then they started adding insulin injections. And I said, when did they do that? And she said, it was about 2 months ago. I said, when did the mucositis problems get so bad that now that you're in this terrible pain? She said, 2 months ago. And so anyway, she went away. She was supposed to come back in a month. I wanted her just to try the diet changes. When she came back to see me, she's off all of her diabetic meds, which was a dangerous thing because I should have made sure she was in contact with her physician. But when she came back to see me, it was supposed to have been in a month. She didn't see me in a month. She ended up coming back in 2 months, but she wanted to come back to tell me the great news. She lost 30 pounds without exercising, off all her diabetic meds, and the skin condition inside with all the ulcers. And first of all, in 25 years that I've been practicing as a dentist, I've never seen it go away. And it only gets reduced. And it only gets reduced maybe to a manageable phase. It rarely makes much of a difference. That's why I felt terrible about seeing them, because it just didn't make a difference. She came back to see me. She had the soft tissue architecture of a healthy 20-year-old. I was flabbergasted. And since then, I've tried or recommended it for a couple of other patients with similar scenarios, and it is amazing. And now they've been diabetic patients. I've had others with other types of background where I just needed something to be more control with their inflammation because we're going to place implants and I wanted a good healing environment. But anyway, that's what made me want to reach out to you because, wow, it can affect, obviously we know it can affect multiple aspects of our general health, especially as inflammation is connected to things. And for this patient, this was about 4 months ago. And she's still going strong and certainly falls in line with everything that I've heard people talking about. I wish I knew and understood. I'm going to keep reading and listening. There's just a lot to understand. I think it's terrible that the thing that we've been doing in the Western part of the world is we're monitoring carbohydrates. I want to know what's going on with the insulin. I had a continuous glucose monitor. It's great to be able to see what it's like when I eat foods and what things spike and what things don't. But man, I want to see when my insulin spikes. They don't have a continuous insulin monitor. I want to know how my sleep patterns affect it, how stress affects it. And that could give me a lot more information. I don't know if we're ever going to get to that point, but I'm looking for people that are doing that kind of research. I know they're doing that in Europe.
Yeah, I think there's some prototype insulin, sort of continuous insulin monitors that are being developed right now. I know some people that have delved into that a little bit, but it's certainly a ways off for being accessible widely. So I'm just curious now, because you said I don't want to see mucositis because nothing I can do about it. Now are you like, hey, I'll take them? I'm
tending to want to see them a little bit more. Yeah. Because I'm excited for it.
Right. Exactly.
I can make it different. Now, as I've tried it though, people are resistant.
Yeah, sure. Yeah.
Because they have to be hurting. The people that I want to see are, yeah, it hurts. It's annoying, but as long as I stay away from spicy food and as I use this topical corticosteroid, I can manage. I don't want to take that kind of a leap. And it's such a big change. So they have to be desperate enough and the thing that's interesting about the diet is the first month was rough. Not to have my donuts or the things that I liked. I didn't eat a lot of sugary things, but now I've really learned, I enjoy the lifestyle. I enjoy a good steak. If it's got some fat on it and the flavor of it, I look forward to it. And I try to get people to realize, no, you can still enjoy life. It's still very enjoyable. And I thought I'd be giving up a lot. And actually, it's not that bad. Yeah. I don't know if you feel the same way. I don't know if you eat mainly steak or.
Yeah, I made a big old strip loin roast yesterday. I've got a little leftover I'm going to have today. I'm looking forward to it. But let me ask, because you said, let me stick with the dental stuff for a little bit. So periodontal disease of the various types, you said some of it you think is amenable to diet, some of it is not. Maybe you can, again, obviously you probably don't know all this because you haven't had a chance to test it all, but I mean, what do you think the things that are amenable to dietary change with regard? I remember when I went to, this is in my late 50s now, and I was in my 40s, and the dentist would say, hey, your gums are receding. We might have to do like a gum augmentation type of thing or transplant where we move it up. And then I switched to a low-carb diet, and then that sort of discussion went away. I no longer had that issue. So what is realistically maybe modifiable by diet and what's not? Because that's also important so that people don't ignore something that really needs more aggressive attention.
In my field, the thing that's going to affect your diet will. I think that modifying the inflammatory background that's there as you're assaulted by bacteria that are they're just endemic in your mouth. My feeling is, and this is debatable, that the bacteria that cause this problem exists in everybody's mouth. And they get kick-started depending upon what your profile is. And now, like I was saying with Jordan Peterson, or with what you've just described, if you go past certain thresholds, when periodontal disease is caused by the bacteria in and of themselves don't cause a problem. What happens is they go into a depth. If they go deep enough and then they mineralize, then the bacteria get entombed in this mineralized plaque that we call tartar. Well, when I'm doing surgical procedures, what I'm trying to do is go in and clean that all away to detoxify. I need a pristine, sterile environment. Then I can graft bone. That tartar, that mineralized plaque, that contains dead bacteria, and they'll never go away. And part of the problem with the dead bacteria is they're releasing cell membrane layers all throughout however long it's going to be in your mouth. It could be decades or your whole lifetime. And those cell membrane layers are cytotoxic. So there's that problem. When the pocket is created because of that depth as well, you have living bacteria. You can get placed on an antibiotic for that. But if you go deep enough and you can't resolve the bacteria that have mineralized themselves to the side of now that's the problem, is how much depth. If you catch it early enough, you can have someone, if they change their profile, what their tendency is, then I think you could have someone spontaneously get to a point where they experience what you did. All of a sudden, they're not talking about it anymore. If it's deep enough, all you're going to do is make things look better. It's not going to be as inflamed because the inflammatory drive to try to get rid of it isn't going to be as pronounced. You do want it pronounced where it's present. That's going to be the deep substructure, and you just won't be aware of it. And the teeth will get loose. You could still lose them. That's why I wanted to make sure people know that a lot of things have to do with timing. And you get something at a certain stage 4 cancer, we have to be prepared to just not recover from that. Stage 1 now, and if we're talking about periodontal disease, that type of thing, I think could resolve. If you're at the middle to early stage and you change your diet, I would dare say that we're going to end up finding in the future that just by changing at least the insulin spiking, so that we know now that insulin, one of its primary roles is it releases cytokine. The higher or the more often insulin is present, the more you're going to have an inflammatory component. And that's how it falls into this diabetic component. That's why they have a lot of problems, diabetics, because they're compensating for the fact that whether they're insulinemic or hyperinsulinemic or not, that higher load of insulin is what causes problems. If we can decrease that just with a diet, whether it's intermittent fasting or whether it's a protein diet, you're going to be able to make it so that you just don't release as much of those inflammatory markers that can create the problem. But again, it's when you catch it. It's going to be sometimes yes, sometimes no.
I would imagine, maybe correct me if I'm wrong, but I would imagine that having diabetes or prediabetes or diabetic pathophysiology is associated with higher rates of periodontal disease. Is that a fair assessment?
Yeah, that's solid in our literature. We see a diabetic patient right away. We're going to assume that they have periodontal disease by definition. And from what we've discovered, just to be insulin resistant, which can be our profile for anywhere from 10 to 30 years before you're diagnosed as a diabetic, that profile is going to predispose you. Yes. But definitely the literature shows if someone has an HbA1c of 10 and your periodontal disease is treated, because you're going to have periodontal disease, you'll knock 10% off of those HbA1c numbers. And internal medicine docs are thrilled with that. But obviously we know a better way. I was always taught you cannot cure diabetes. And I was always taught you cannot cure periodontal disease because they're commensurate. They're driven genetically. It's an immune system problem. To discover now that no, you can get to a point where I would say now I can start using that word, especially when I've seen that there are people that no longer need their metformin or insulin and they're stable when they get on a protein diet and when they try intermittent fasting, which is another way to potentially try to get around that without modifying much.
Yeah, the comment was that it's amazing that someone who's practicing as a dentist is actually reversing someone's diabetes, whereas their primary care physician has not. It's crazy.
That's not my job. That's right. Out of the scope of, wow.
Yeah, that's pretty darn amazing. The so-called root canal, is that something you would do? Is that part of your
No,
purview?
That's another specialty. An endodontist would do that. And that's associated more with caries. So if you're going to have a root canal problem, there could be other reasons for it, traumatic injuries, but root canals are going to be because decay gets large enough, it penetrates into the internal aspect of a tooth where blood vessels were coarse. And if you contaminate to that aspect, then you've got to take out all of that living material on the inside of a tooth, and it's fill. And anyway, there's a whole specialty for that. And I'm glad, because I hated doing those in dental school and even as a general dentist when I was in the military.
What is, as you've seen, diet clearly has a role. It's no secret that sugar causes dental decay. I've known that for, God, I don't know how long, forever probably. What is the position of the American Dental Association on diet? Do they have one? Do they teach you when you're training, hey, these are the type of diets we should be advocating for, or is that just not talked about?
They do. They've got a pretty good push that way, and they're very good about things because they want to identify how fluoride can be helpful, but also how to prevent it through diet. But they focus mainly by talking about high glycemic index foods. If you get somebody that really spends a lot of time with you and they want to go through the literature, it's going to be, don't eat the foods that tend to get caught in between your teeth that can stick around like a Dorito. Even though that's not high glycemic, its presence is going to be there for a long enough time to feed the bacteria, kickstart the acid production. And then we really focus on the sugary things, the high glycemic things like soda or sugar in your coffee. But they don't talk about carbohydrates, at least not right now. But I think that as we continue to get more and more evidence this way, I think that's going to be part of the dialogue going into the future, because maybe not so much with caries, because that's much more of a hygiene issue and is directly related to other things you just can't avoid. Can you develop cavities with just a protein diet? I think it would be difficult, but to get people to live by that mode only and to have that as a public measure push, I don't know if we'll ever get to that point. I don't know if a professional organization would even, push something like that. But it would be interesting if that would be a great place to do studies for dentistry.
Yeah, even if it's just for the people that have some level of disease. Maybe you catch them early on. You say, hey, we can reverse this, so we don't need all this massive amount of intervention. That would be at least I think a fair compromise. But if we even get there, it'd be interesting. What about, so you talk about things getting stuck between your teeth. Sometimes I'm chewing on a piece of steak and a little bit will get stuck between my teeth. Is that a disaster for me too? Is that waiting for things to happen because you get in and you try to get a toothpick or something like that to get it out?
It's not necessarily a problem, but one of the things that we always identify for people is you don't want that scenario if you can possibly help it. You either want a tight contact that doesn't allow for things like that, or you want a highly open contact. You don't want one that tends to trap food. And if you do trap things, it's going to feed pathogens. And it can make it so that things create an environment so that all of a sudden you have an anaerobic environment. But most of the time, things like that are a problem if you never attend to them. If you're getting to things and you're brushing and flossing on a daily basis, you're going to be fine with something like that. And so I would say, no, that's not a problem. But if it's a carbohydrate, oh yeah. Then I know that we're going to start seeing all kinds of other issues with caries, but not for periodontal disease. So at least that would be my take on it. I'm curious to see what my colleagues would say. They might berate me for that. I would say no.
So you said at the beginning you had concerns about maybe the diet, perhaps maybe long-term. A lot of people have issues concerning around cardiovascular disease. Maybe, I'm going to raise my LDL cholesterol and therefore we assume that's associated with cardiovascular. I just out of curiosity, maybe there's no literature, maybe you don't know that. Is like elevated LDL cholesterol associated with worse dental outcomes? Do we have any evidence to suggest that? Or is that just nobody knows about that?
No, I haven't read. There could be things out there, but I haven't read about that. I know that your cholesterol definitely is a player in your immune system, and it helps having at least your low density, which is usually thought of as the bad form, but it can help to, when you don't have that present, that can compromise your immune system. So it can be a healthy thing. I think cholesterol is shown to be quite a mystery right now. A lot of the things that people talk about with statins, they're not pushing as much and people are resisting because it's the fog right now. People are changing their minds on some of the direction they've been pushing. And there's not a lot with dentistry. So I'd be speaking out of place if I really commented much more than that. But I'd say no, I don't know much right there. Not a lot.
And so you said you had a few concerns about maybe the diet, perhaps long term. I think that's what you said. What do you mean by that?
Yeah, I wouldn't say concerns. For me, I have a conflict of interest. For me, it's my religion. I'm a member of the Church of Jesus Christ. I'm a Latter-day Saint. And I want to be honest with my patients about the fact that for us, we don't say that meat is the only way that we should go. So I'm conflicted that way because I want to be able to be honest with myself at the same time, I think some of the studies that have been done by the Seventh-day Adventists not disclaiming themselves, because they definitely advocate for only a vegetarian diet. We don't. We say meat is fine, but we also say that other foods are also good. And that's a religious tendency. And I try to be devout in my faith. And so I'm trying to resolve that in my mind. I'm wrestling with those ideas, but I'm fine to challenge it. But I wrestle with it. So it makes me say, how is it that these other foods cannot be good for us? Man, I'm getting proof of principle just in living this way. But I'm really bothered by a lot of the Seventh-day Advent literature that's come out supporting a vegetarian diet. And a lot of what's going on with our food pyramid is because of their research with no solid evidence. It's all anecdotal, or not anecdotal, I'm sorry. It's just epidemiology. And they base policy on that. And I think that's created probably the biggest thing, the biggest input into the obesity problem, especially among kids at the start of the 80s, was the food pyramid. And it's terrible that those studies were published without somebody saying, you know what, we do have a conflict of interest. We do have a bias. And that's my only ration. For me, I have to stop myself because I want to tell everybody. But internally, I'm just conflicted that way. So it's more of a moral issue for me. But boy, the evidence is just, it's overwhelming for me. I feel great. My energy, I don't want to get rid of that. Is this the way everybody should live? I'm more than happy to advocate for that because it's what it has for me. But it's it seems so extreme as I explain it to people. They have that look, and I realize I sound like a crazy man.
Yeah, I've been there.
Anyway, that's my story with that. So I'm just wrestling with those ideas. So
yeah, interesting. When I was in the military, my surgical partner, great guy Jake Oldham, he's also LDS guy, a super great guy, and he has been exposed to carnivore, has adopted it, has used it for some of his patients. I haven't talked to him in a few years, but you're right. You see this like Loma Linda, where there's sort of the heart of Seventh-day Adventism. And they talk about their population studies, but there are equally, like I said, LDS or Mormon populations where they live just as long and they eat meat and they don't talk about it. They sweep that under the rug a little bit. So it's one of those things where, and it may be that you say meat is the foundational food and then you've got all these other, what I call accoutrements, flavoring enhancements as the other stuff. And that's a way to maybe think about it in that terms. But a meat is the meat of the meat. The meat is the food. You go back, and most of the religious doctrines celebrate, outside of like things like Hinduism, they celebrate meat as essential and pleasing in the eyes of God. So yeah, it's interesting. It is an interesting dilemma to have that. But have you discussed this with any of your dental colleagues at all? Have you been able to and had they had any response to this?
I have not. I've really hesitated, but I'm going to now because this happened a few months back and I have something to be able to hang my hat on other than just me. It's not an N of one. I've had 4 patients that have had similar results to this one patient that I mentioned. One had just lost a lot of weight. So like I said, I was just trying to prep them for implants, but I've had 2 others in addition to this other person that mucositis was resolved. And so now I can let them know I don't know the exact mechanism. I can explain some of the rationale, but I'll definitely be at least having conversations. And then that will lead, I'm hoping, to just research. That's where, and I'm really excited about some of the things you're doing and how you're advocating for that, how they've done at Harvard, a study now where they've been able to at least get some proof of principle. But we need more of that. And certainly for me, I'm excited for where I think it could take us because now we're getting to the point where you can use that word, the cure word, where we weren't allowed really before.
Yeah, are you familiar with Kevin Stock? Do you know Kevin Stock?
No.
He's another dentist, carnivore advocate. He's been doing this for a long time. Great. He's got a lot of information. I think he's out in Virginia though, so he's the other side of the country. But Kevin, S-T-O-C-K, you should look him up. He's got he's a huge carnivore advocate. And I've met several other dentists along the way that do this. Okay. There is, as far as, like I said, the research, one of the things I've discovered, because you mentioned that mucositis, this is a type of autoimmune condition. We see a lot of success with different autoimmune diseases, and there's a lot of thought that it's mediated through gut dysfunction, correcting that, whether it's gut permeability or dysbiosis, whatever it might be. It seems that has had an impact. There's some work from a guy named Alessio Falzano and at Boston's Children looking at autoimmunes, and he has several papers he's written on that are published in the literature going back from, I think they started in about 2010 to about 2015, looking at the relationship between autoimmune disease and gut basically gut permeability issues, which a carnivore diet has been shown to mitigate that or reverse that in many cases. So that may be part of the pathophysiology that you're fixing. So it's interesting. As far as what percentage of your patients that walk into your door, do you think, if everybody would accept it, and clearly that's not going to be the case, but could you see a role for a dietary shift in a significant percentage of patients that walk in your door?
If they would do it, I was thinking about the numbers. I think that I would get rid of half of my patient population. A lot of my cases are trauma-based.
Yeah.
Whether it's because someone's in an actual motor vehicle accident or they just brush too hard. You can do too much. Too little of something, too much of something. And people will brush away soft tissue architecture. But the disease-based stuff, boy, I think we could get to a point where that's just not there anymore. But how to get them to do it? Boy, marketing and education. Yeah. Half of it is someone has to be willing to listen and then willing to make a drastic change and experiment just for a month. That's what I tell them. Just try for a month. Yeah. But I think that I could get rid of a big part of our population.
Yeah. The other thing is having a support system, because even like knowing what you know and knowing what the right thing to do is to get people the support that they can actually do this, because it requires ongoing support for a lot of people. That's one of the reasons why I do this every day. And you think about it, you're like, I'm actually putting myself out of business in a way.
Yeah, yeah.
Which is
yeah. That means we might get some resistance. That's right.
Yeah, I mean, I get
a lot of business. Yeah, but you know what? I think that it's funny how things get replaced. You just find a way to do other things. You do a lot more cosmetic stuff. You make someone more beautiful instead of just worrying about trying to fix something that is absolutely needed. You can do it more of an elective way. I don't know, but you're right. That's going to be difficult. You can see a lot of people pushing back because of that. You don't want to get rid of too much business. But dentistry's been good about that. We pushed the fluoride issue, and people have said that in the past. You push that, and you're just getting rid of more work that you could do. And I hope that we don't lose that altruism, that sense of, no, we can do a really good thing for the public by pushing for these things. That might be the new thing in the 21st, huh?
We can always hope that we can minimize the disease burden, and then we can worry about, like you said, trauma is always going to be there. There's going to be some things that we need healthcare and dentistry for. But I think we've got such a bloated healthcare system where we're not doing anything. We're just basically rearranging the deck chairs on a Titanic in a lot of ways, and we're spending $4+ trillion a year and growing every year on that. And I don't know what the dental expenditures are, but I'm sure they're in the many billions of dollars that we spend on
business. Yeah.
So
people don't want to. No, I'm excited for the thing that was connected us, not you and I, but periodontal disease and H. pylori. That's the gut bacteria that was discovered by Warren and Wallace. They're a physician and just a researcher in Australia. My grandfather had his stomach cut out, and that was a standard of practice back then. You were diagnosed with an ulcer, and you lost your stomach. That was the way. Everyone had stress. And anyway, it was just interesting. Those guys were just so recent. That was the 90s. And when they published their findings that ulcers aren't caused by stress, it's just a bacterial infection, you just need an antibiotic, they were pilloried for that. Mm-hmm. And it took them almost 10 years before they got a Nobel Prize for their work. And anyway, I'm hoping that type of thing doesn't go. It seems like we're in an environment now where nobody wants to. I mean, when I go to our meetings, our professional organization, and people are duking it out and yelling at each other, talking about the research, berating each other, and you're supposed to talk about it. You're supposed to debate and sometimes say things that are not very nice to each other, so that you can get to the meat of things and figure out where the chaff is that needs to be thrown away and keep the stuff that's good. And we don't do that. Boy, we learned that with COVID. You are not to question anything. But I hope that as we introduce things like this controversial topic of a type of diet that seems radical, man, just try it. We have to experiment. This is so flabbergasting to have such solid evidence and to still have resistance. I'm just surprised that people want to dismiss. I've seen some of the interviews with people that come on, the Stanford professor that was just talking about these idiot carnivore people and not talking at all about the fact that what about what happened in their lives? What about the fact that the diabetes is gone? What about their skin conditions? What about the energy levels? And to totally dismiss that, and it's pretty remarkable to be in that kind of scenario, right? That environment where people are not willing to talk about things. They just want to shut you down. And I'm hopeful, though. If it happened for these guys, Wallace and Warren, you're part of that. I appreciate how you've influenced me. Joe Rogan, Jordan Peterson.
Yeah, we can all, we just got to keep trying. And I think the fortunate thing is it's not going away. If anything, this sort of thing, more and more people are exposed to it. And the more people are exposed to it, the more people get good results. And it becomes hard to deny, even though it's grassroots and you don't have the academics supporting it yet. And maybe they will, maybe they won't. But I think the toothpaste is out of the tube at this point. It's not going back in there. So it's interesting to see how this will play out. It can only, as you mentioned, it's good to have scientific robust debate to get to the heart of the truth. That is the whole point of science. And censorship, as we saw or see, that's there. And so that specter of censorship, not letting the other side speak, is very dangerous, obviously. And like I said, I don't know if can you shut down 1 million people. I don't know if you can make them all shut up, but I don't think it's going to happen.
Not in our day.
They're trying. We're trying too. So anyway, let me ask you, Derrick, because we only got a few minutes left, but do you have any like social media stuff? Do you do any of that stuff? Or do you have like if somebody wanted to see you as a dentist, maybe there's somebody in Northern California that says, hey,
I don't do any. I've been trying to get something like that off the website, whatnot, but I have a lot of work.
Yeah.
I work 14 hours a day. I'm still working pretty much 6 days a week and just trying to manage my time. And so I don't need it as a marketing mechanism. Mm-hmm. But now I'm motivated in other ways. It's this could be another way for me to help my patients. And I don't have time to sit because this takes time.
Yeah.
I don't have time to go over this in one single session. I've got to do my exam and I've got to get to somebody else. But if I can record things, get it online on a website, for my patients, I can see how that would be a wonderful. So now I'm motivated for that, but I don't have anything right now. I'm just working all the time.
Yeah, like I said, go take a peek at Kevin's stock stuff. He's got a pretty extensive website on this, and I don't know how much he gets into the dental side of it because I've interviewed Kevin. I know I've met him several times, and so he's a good guy. But he may have some like resources for your patients that you can say, hey, just go check this out, and this because you obviously
if I don't have to remake things, right. The mousetrap,
exactly.
Well, that's good. I appreciate that.
Derrick, thank you for sharing your story. I think it's awesome. It's another thing. I'd not heard of this mouth condition, this mucositis before. I can say here's another one that Carnivore has at least helped. And I've got a collection of on our website. We've got literally over thousands now of just testimonials of this stuff. And it's hard to, when it's one or two, it's all luck, but the numbers are becoming enormous and it's hard to dismiss that out of hand like so many people do. It's just an anecdote. There's thousands of them now. So you're going to dismiss all of these people as quacks and cranks and crazy people? Probably not.
Yeah, you can't ignore that, boy.
Yeah, some people want to. You see some people just hands over their heads. We're just going to keep yelling.
You don't hear it. That's right.
Yeah, let's keep going. Thanks so much. Appreciate it. Have a wonderful day. Yeah, likewise. And
I like to do some grappling someday, all right? I was telling my staff, I know you're a big guy, but man, maybe I can do a rear naked choke. I'd be like a squirrel around your neck and take you down. That's the way I was thinking. If I could do that, I feel really good about myself.
That's where, like, the guys that I roll with that are small, that's where they have success. If they can get my back, they can get
That's right. That's the only way.
That's their best chance. And sometimes it works, sometimes it doesn't. But anyway, all right. Good to see you guys. Thanks, everybody. We'll see everybody tomorrow. Bye-bye, guys.